our focus for the next couple of minutes. Now, we have joining us on Skype Dr. Alero Roberts, second Vice Chairman, Association of Public Health Physicians, Lagos State Chapter. It's good to have you, Dr. Roberts. Thank you for joining us on TVC Breakfast.
Thank you very much for having me. Good morning.
Great. Now, Guinea has announced, the WHO has announced the outbreak of Ebola in Guinea. And so far, about 7 people, and still counting, have been infected, and about 3 deaths, or even a little more, not less than 3 deaths have been recorded so far. How does this compound the situation when we are in a pandemic already with COVID-19?
To be honest, it raises it by a factor of about 10. You know, it's just the scariest thing to imagine, because if you will recall, Ebola has a case fatality rate of between 25 to 90%. The idea that we may be here battling both the coronavirus and Ebola viral hemorrhagic fever is actually quite scary. And to that end, we've all been placed on extremely high alert around the country, particularly, in the public health space, to be on the lookout and to be able to manage it.
All right. Now, when these health challenges of this kind of proportion come up, Nigeria is usually a destination, being that Nigerians travel a lot, and then people also travel for different reasons into Nigeria when it comes to the sub-region. What kind of precautions should Nigeria, and maybe even Ghana that is even closer, what kind of precautions should we be taking right now?
I think definitely I've got a lot of confidence in our airport security, our airport surveillance system. I've just returned to the country, as you know. Our airport surveillance system is absolutely top-notch. The concerns that I would have, and I'm sure Ghana would have the same concerns, would be the land borders, because as you know, there is a lot of vehicular trade that goes on in the West African sub-region, and there are a lot of land border crossing points that are actually unmanned. And it'll be very, very difficult to actually shut down the vehicular trade movement, because the sub-region depends on it for its economy. But keeping up our surveillance will be critical, and making sure that we keep the community education and community participation on very, very high alert will be absolutely critical. And I'm sure this is where we're focusing a lot of attention around the sub-region.
All right. Nigeria has always played the leadership role in the sub-region as well as on the continent. We saw amongst the countries that had Ebola several years ago, Nigeria was one of the only countries who didn't need help from outside and handled the issue within itself, and also had to render help to other countries. What kind of leadership role would Nigeria be playing now in a way of helping Guinea and even Congo with this outbreak right now?
An absolutely crucial one. A lot of people may not know, but the then Commissioner for Health for Lagos State in 2014, that successfully saw the end of Ebola, literally did a hand-to-hand baton change with the present Commissioner for Health for Lagos State. And certainly the expertise between then and now has certainly ramped up by a factor of 100. Out of the Ebola situation, we now got the Lagos State level 3 biosecure lab, which has led to the spawning of labs all around the country, thanks to the coronavirus. If the coronavirus can be thanked for anything, we must be able to say that because of the coronavirus, we have literally gone leaps and bounds in our ability to handle the viral transmission of diseases with so many laboratories able to test and identify viral illness. We are in a very good position. So our leadership is crucial and critical and is available. And I'm not sure it's quite correct to say that we did have a lot of international help at the stage of Ebola, but you see, it was reversed. We got the help that we asked for, and we were able to leverage on that help in so many different ways that a lot of people do not know about. The diplomatic corps were absolutely on hand and helped us then, and are helping us now, and will continue to help us as we go forward, because their citizens are also in country, and their citizens are also vulnerable. So our leadership is crucial on this, and it's certainly available, I am certain.
All right, talk to us about the availability of Ebola vaccines, making them available in Guinea and Congo to ensure this doesn't spread.
So I just read up on what the WHO, and particularly Afro, is saying and doing, and certainly that is critical. And efforts are on right now to acquire as many vaccines as possible, both the Ebola vaccine, which is a little bit more stable than the coronavirus vaccine. And everything is on hand. They're sending teams into Guinea to contain the spread so that it doesn't even spread within Guinea, talk less of spreading outside the border. So we've got to realize that our systems are in place. They are robust for the public health intervention, but it still depends on our collective responsibility towards this. Don't forget that the mantra for Ebola then is still the mantra for coronavirus: hand washing and absolute paying full attention to public health hygiene and personal hygiene in terms of hand washing and keeping a critical distance from people and therefore from dead bodies and not attending funerals. Don't forget, that was where the Guinea outbreak came from, people who attended the funeral of a nurse who died. So it is absolutely essential that we continue to maintain these public health interventions in order to make sure that this doesn't come our way.
All right. Now, you said earlier that the areas that should be checked more will be land borders because the precaution at the airports are top-notch, if I have to quote you directly. Now, we recall that in the early 2014, 2015, and 2016, when Ebola was ravaging Guinea and Sierra Leone and parts of Liberia and all of that, there were the issues of closure of borders. Would you be suggesting this at this time? Would it be advisable for border closure as a way of prevention between countries that are bordering Guinea?
Don't forget, the borders are closed. They are closed because of the coronavirus. Apart from essential travel, all borders are actually closed. And this is what I'm saying about the porosity of the land borders, compared to the surveillance. It's easy to maintain strict surveillance standards at airports because that is a pinch point and everybody has to come through a particular entry point. So it's easy to maintain surveillance systems at the airports and at the ships because, again, that's another pinch point. You come to the dock and it's easy for us to have our surveillance systems here. It is our land borders that will prove very challenging, and I really don't envy the port health and immigration services that have to work hand in hand to ensure that this doesn't come our way.
All right, the pandemic has drawn our attention to the deficits in primary health care. Government at one time or the other had raised the issue of trying to put up policy to strengthen primary health care in the country. And that advice was also given to other African countries as well. What should we be doing when it comes to strengthening the health system as well as the health infrastructure in our countries now?
Everything possible must be thrown at revitalizing and strengthening the primary health care system. It is absolutely critical and crucial. It's even our first defense system. It's our first defense system. That, we don't need intercontinental ballistic missiles more than we need a strong and robust primary healthcare system. That is our surveillance point. That is the point at which we connect with the community to even watch and see and find out what is going on. It is so evident. A virus that cannot even be seen with a regular microscope, talk less of the human eye, has literally decimated the entire world. Primary healthcare system is our first line of defense, and everything that can be thrown at it must be thrown at it. Financial, material, human resources, technology, everything must be thrown at it to make sure that it's robust enough to care for this. I mean, if somebody, God forbid, a lorry driver or a truck driver is coming through an unmanned border post carrying the Ebola virus and he gets sick, where is he going to go? To the nearest clinic. That is the primary healthcare system. It needs to be robust enough to identify, track and trace and treat, if necessary, isolate anybody coming in anywhere that may be ill of anything, including Ebola.
All right, now, one other area of concern is the issue of welfare for health workers and frontline workers against the COVID-19 as well as Ebola. What should really change? Because this has been on the front burner, and from the reports we get, nothing really has changed much. But what should we drastically do in that regard now, and how will that help?
That's a very loaded political question. Let's be honest. The government knows what to do. And there's a very simple catchphrase. Just do it.
Just do it.
Just do it.
Okay.
You've got to remunerate the health care workers. And this is everybody, from cleaner to clinician. Every cadre of healthcare worker needs to be remunerated and incentivized to stay at their duty posts. They don't need to be distracted at this moment looking for extra sources of income to maintain body and soul together. They need to be remunerated so they can stay at their duty posts. Cleaner to clinician, no difference.
All right, let's talk about the issue of collaboration between countries. We hear that sometimes there are a few countries that collaborate together, to help in the fight against some of this kind of diseases and pandemic. What more can we do as a people, especially when countries many times are not able to stand on their own, where they need collaboration to pull resources together? What kind of collaboration should we be having, especially in the phase of the outbreak of Ebola right now in Guinea?
Well, I think we have a lot to learn from the global scientific community. I think it was very interesting that I was listening to something the other day. I can't remember exactly what it was, but here we were talking about a biomedical emergency in terms of corona, and the person leading the research team was a physicist, and I thought that was absolutely amazing. The global scientific community has got it right. In fact, they are collaborating hand in glove. There's no difference in country, creed, or color in terms of their level of collaboration, and the world has a lot to learn from that. Right now, rather, what we are seeing is a lot of nationalistic tendencies where every country has gotten an attitude of "to your tent, so Israel." But that is not what is needed in this. We do need to collaborate a lot more. And if we do take a lesson from the global scientific community, you will find that even over the trade communities, economic communities, we will get a much better level of collaboration, which means that we can stand together better to fight every aspect of the spread of these viral diseases. Coronavirus is one. Case fatality rate less than 10%. Ebola is a completely different kettle of fish with a case fatality rate of up to 90%. So it's something we definitely need to have a lot of global collaboration on, and we can learn serious lessons from the scientific community.
All right, let's come back home on people not adhering to safety protocols and all the guidelines that are given by the government and also health officials. Now, it has become law now for people who violate COVID-19 protocols. When it comes to enforcement, we've seen enforcement in some places and then in a few days, and then we don't hear much of that. What should we be doing really? Because after a persuasive approach to the people to adhere to protocols, that doesn't seem to be working so well.
Well, the truth of the matter is that changing human behavior has always been notoriously difficult. But, we still have to continue to beg and plead and cajole and encourage everybody not to be a mortality statistic. It doesn't even matter if only one case of death occurs. That one case of death is still a person, a family member, a loved one, leaving an empty seat at the table. So we will continue to beg and plead and encourage and cajole everybody to keep to the public health interventions, maintain a social distance, maintain a physical distance, don't get into a crowded area, don't attend funeral parties and wedding parties, don't even throw them. Wash your hands regularly, maintain a very high level of personal and environmental hygiene. What else can we say? Don't be a mortality statistic. Don't cause your family members to carry their hands on their head and cry on your behalf and then not even be able to attend your funeral. There's no need. We have to continue to preach not only the value of life, but the cost of death.
All right. 1 year after COVID-19 became prominent, we still hear even some leaders say that they don't believe in COVID-19. It doesn't exist. People have lots of followers here and there. When it comes to enlightenment, how much of this should we do? Because if you're out there, there are posters, there are handbills, people are talking about COVID-19, but when it comes to knowing the details of how to and all of that, do we say that there is information fatigue and people are getting relaxed now? Is that what the case is?
People are getting relaxed. I can speak definitely for Lagos State, where we have ramped up information and communication and community involvement and engagement to a very high level. And a lot of people are aware. Whether they choose to take it seriously or not, seriously, that is a personal choice. Unfortunately, for leaders who are insisting on leading their people off the cliff, what do you want me to say? That has been since the dawn of time and probably will continue. But everybody has access to the information. I must commend the media around the country for doing such a great job and for partnering with all the relevant organs of science and medicine and nursing to put out the message. If people choose to listen or choose not to listen, that's their tralala, I guess. But I will beg, and we will continue to beg, plead, cajole, and encourage everybody not to be a mortality statistic. Just keep to the very simple rules. Forget the politics, forget the finances. It's easy to maintain a physical distance, keep your hands clean, and wear a mask. It's easy. And now, more than ever, it's imperative.
It's easy. I like that because they say prevention is better than cure. Thank you so much, Dr. Alero Robert, Second Vice Chairman of Association of Public Health Physicians, Lagos Chapter. We appreciate you for joining us on TVC Breakfast.
Thank you very much for having me.